Thank you very much. This is a privilege to be here with you all. Actually, I have to thank to my University of Porto, for inviting me, and thank the organizers for having me and accepting this presentation. My title is even longer than my colleague Eric Cassin, as you can see, but I will focus actually on, let's say, psychological and mental health, and also sexual health in the context of global health, and why it is important to include mental health, psychological health, and well-being in sexual health among the core domains of global health, and actually also of EUGLOH and EUGLOHRIA. So I actually, when I look at the EUGLOH main topics, as you can see there, so this is what is on our website, and I will start by asking you to make a very simple psychological exercise, attention exercise. For the next, let's say, 10 seconds, could you please find where is psychological health or mental health or sexual health on these core domains of the EUGLOH?
Social and human sciences.
Anyone else? Anywhere or nowhere? You can see there, or you can do a very interesting exercise for where can it fit. But you can see probably over 10 or almost 20 terms there, and you never see the word psychology, mental health, or sexual health. So what I will try to do in the next 19 minutes is try to convince you why this is important to put mental health, psychological health, and well-being in the map of global health and the EUGLOH. I actually use mostly data from the WHO, so I didn't need to do anything else. Just look at data, global data, the World Health Organization, which just crossed 75 years last year. And so actually the definition of health by WHO is what you see there. Health is a state of completely physical, mental, and social well-being, and not merely the absence of disease or infirmity. So mental health is at the core of the definition itself. And then if you see further, the enjoyment, so the word enjoyment in itself is interesting. The enjoyment of highest attainable standards of health is one of the fundamental rights of every human being. So you see the word rights or human rights attached to health, which is also a very key point. So I didn't invent this term, no health without mental health. Actually, it was WHO using this term. Mental health is more than the absence of mental disorders. This is also very important. So it's, of course, mental disorders are key, but mental health is more than just that. So from a positive perspective, promoting mental health and well-being is an integral part of health, as they say. Is determined by socioeconomic, biological, and of course also environmental factors. And the most important, we know right now, because there's enough evidence to say that we have cost-effective public health interventions. They exist, and they can promote, protect, and even restore mental health. The World Mental Health Report was published 3 years ago. I will actually briefly guide you through some of the main facts related to mental health. So again, this is WHO information. In 2019, 1 in every 8 people in the world, so around the world, almost 1,000 million people, were living with a mental disorder, a diagnosable mental disorder. Anxiety and depressive disorders are the most common among those mental disorders. And even more important, during the COVID, the first estimates show that there was an increase of almost 30%, 26 to 28% increase in anxiety and depression due to the COVID. So we don't have, at least I'm not aware of recent data after a couple of years after the COVID, but it's interesting to see the facts about the important increase in mental disorders, particularly anxiety and depression, due to the COVID and the pandemic. If you look at this picture, you can see actually that the two most common disorders are clearly anxiety and depressive disorders. almost 2/3 of the disorders, or around 60% of the mental disorders, are related to anxiety and depressive disorders, a little bit less development disorders, attention and deficits of hyperactivity. But if you look at your right-hand side, you look at, it's interesting to see that the estimates of mental disorders are higher in the high-income countries compared to the lower-income countries. So around 13%, but around 15% in the higher-income countries, a little bit less in the lower-income countries. Another very important aspect, it's not just having a mental disorder, is that that mental disorders are the leading cause of disability. So what data is saying is it causes 1 in 6 years lived with disability. And also very important, people with severe mental health die on average 10 to 20 years earlier than the general population. So this is, if you look at it, this is an amazing, overwhelming fact. And it's mostly due to preventable physical disease. They don't die of mental disorders. They could suicide. I will present also data on suicide, but most due to preventable physical diseases, and because they are depressed, anxious, or with different mental disorders. The burden of mental disorders, there's also data on the burden. And one of the interesting findings is that proportion of all-cause years lived with disability attributable to mental disorders is almost 16%. So the disabilities, the percentage of disability, the all-cause years of lived with disabilities is 1 in 6, as we said previously. And the global burden of mental disorders. Here you can see a reverse pattern where depression is much more important than the other mental disorders, which means that depression plays a very important role in terms of the burden attached to it. And by the way, interesting findings, women suffer in average more than men of mental disorders and of the burden of mental disorders. Another very important fact, stigma and discrimination. Although we are on 2024, there's still stigma, there's still discrimination all over the world, and also actually in Europe. Human rights violations against people with mental health conditions are still widespread. There are still 20 countries around the world who criminalize attempted suicide, for instance. And again, important, the poorest and the most disadvantaged are the ones who are at great risk of mental ill health. So suicide data regarding suicide, suicide accounts for 1 in every 100 deaths globally. So 1% of the deaths is suicide, most recent data. But what is interesting, if you look at the bars, you see that most cases of, or the highest level of suicides are among the youngest population. So before 40 years old. Actually, almost 60% of the suicides happen before the age of 50. So this is also very important to see. So to sum up this part, we can say that mental health conditions are widespread, 1 in 8. Undertreated, that's another important aspect. One example is people with psychosis, which has a very important impact on the person's life, family, and society at large, do not receive mental health services around the globe. And under-resourced, the data shows that only 2% of health budgets, 2% of health budgets around the world goes to mental health. So 2 in 100. Information gap. This is important for us as researchers in higher education institutions. There's incomplete data. Many countries do not report data to WHO. Insufficient research, and we can do much better on that, particularly on the least and middle income countries. And there's also a governance gap. So this is why it's important to close the gap between, of course, research, knowledge, but also how can we transform this knowledge into policies that make people's lives better. Inadequate policies, plans, and laws, this is WHO saying, and misplaced priorities, meaning, for instance, that 2 out of every $3, so 2/3 of the budget spent on mental health, 2/3 of the budget spent on mental health goes to psychiatric hospitals. So this says a lot about how we are investing our money in terms of promoting mental health overall. In terms of research also, gaps in mental health research, the data shows that less than 5% of the health research focus on mental health. So that's probably the reason why mental health is not on our EUGLOH definition. But again, this is even lower in low-income countries as it was expected. So there's a lot of benefits on improved mental health. Of course, you can look at the health impact, the death, actually, to start with, the life expectancies, the reduced suicide, and the health of others, but also social impact, the informal caregiving, which is an important burden for many, could decrease social function and household production increases, and a number of economic potential impacts at several levels. So it's not just making people better, it's not only the health impact of the person, but the environment, the family, the social impact, and the economic impact also. So moving into sexual health, if I still have a few minutes. And sexual health, of course, it's a different dimension, but actually is closely linked with mental health. I should have said at the beginning that I'm a psychologist by training, a clinical psychologist, a PhD in clinical psychology, and most of my research life was dedicated to sexual research. So that's why these topics are so important to me and meaningful to me. So mental health, psychological health, well-being, and also sexual health. But if you look at this definition, again, WHO definition, it has over 20 years now. The definition of sexual health, if you look at it, is also similar to the definition of global health, a state of physical, emotional, mental, and social well-being in relation to sexuality. And again, not merely the absence of disease. And also, WHO emphasizes that sexual health requires a positive approach. This is a very important aspect. And the possibility of having pleasurable and safe sexual experiences. So the word pleasure is also important and safe, free of coercion, discrimination, and violence. So these are the main definition. And again, WHO presented a framework connecting sexual health with reproductive health. This is an important linkage because I'm not sure if you are aware, but there's a specific branch of WHO that is dedicated to sexual and reproductive health. It is called HRP, Human Reproduction Program, and is now over 50 years. But they started focusing only on reproduction, and they are now more and more into sexual health aspects. So the yellow dimensions here are more related to reproduction, and the blue are the ones more related with sexual health. But of course, they are closely together. But I would just want to emphasize that sexual health is much more than just, of course, reproductive health. And again, sexual health is strongly linked with, I would say, many different sustainable development goals. Health, education, comprehensive sexuality education is a very important dimension of sexual health. Gender equality is at the core of sexual health, actually. Reduced inequalities, and also actually peace, justice, and strong institutions. There is evidence showing there's a link between sexual health and all of these dimensions. And again, a little bit of facts related to sexual health. WHO, also the HRP, the program that I just released, the annual reports of 2023 with a number of facts. And here you can see some of very, let's say, very important facts. Very different areas there, but all related to sexual health and reproductive health. 164 million women of reproductive age worldwide have an unmet need for contraception. Every day, over 1 million people acquire a sexual transmitted infection. Over 500,000 people every year infected with HPV developed cervical cancer cases. 650,000 people every day still die of HIV-related causes. And as we've seen this morning, actually, there's an increased range of people infected with HIV in Europe right now. 800 women die from preventable causes related to pregnancy and childbirth still today. 1 in 6 people globally experience infertility. And finally, I would say very important and actually in their lifetime, 1 in 3 women worldwide is subject to physical or sexual intimate partner or non-partner sexual violence. 1 in 3. This should shock us still today. Female genital mutilation, for instance, is still practices in different countries around the world, and we estimate that affects over 200 million women. 200 million affected by female genital mutilation, mostly girls globally. And no region seems to be on track to meet the SDG target of eliminating child marriage. So there's still child marriage in many countries around the world. To conclude this part, just to say also sexual dysfunctions, which is a topic that interests me most, are a leading cause of distress. So there's evidence supporting that. It's estimated, of course it's different in different countries, but we estimate that between 20% and 35% of the population suffer from some sort of sexual difficulties. And the other important aspect that sexual dysfunctions is closely related to depression and anxiety disorder. So again, the connection between sexual health and sexual dysfunctions in particular and mental health is very important and strong. We know also that sexual health is associated with global health indicators. There's recent data showing that sexual health is related to all-cause mortality or the absence of sexual health, with longevity, with number of physical illnesses, and also with depression, and also associated with well-being in a positive perspective, subjective well-being, life satisfaction, positive affect, and quality of life. So for all of these, we have data. But despite this data, and that's my challenge right now, despite the data and despite actually there's a lot of data on reproductive health and data also HIV, AIDS, and STIs, but there are several dimensions that are understudied. Sexual satisfaction, so the pleasure we take from sexual life, the well-being, pleasure and well-being, then the sexual rights and justice are all of them understudied. And the other important aspect is that most of the little we know from the global north. There's almost nothing on these topics besides HIV and reproductive health in the global south. And there's also a lack of comparable cross-national studies, meaning that what we know in the global north in many countries, in most times it's not comparable because they're not using the same measures, the same surveys. So I'll conclude with 2 or 3 challenges. One, this is actually one new, very recent survey from WHO developed sexual health assessment of practices and experiences. And the idea is actually to have a global survey covering many dimensions of sexual health to be used across the globe. And one of the main projects I am involved with, I had the privilege to preside the World Association of Sexual Health in the past. So we started this idea of building the World Observatory of Sexual Health to cover the gap on the knowledge we know about sexual health. And this project, this is still a project, an idea. We will need, of course, resources, funding, networking. We already started networking globally, but it will be very important if the EUGLOH network could join us and help us moving forward at the University of Porto. we have some resources. We have a research center dedicated to psychology, covering most of the aspects that we have been talking on mental health, psychological health, and well-being. And we have a specific group dedicated to sexuality and gender research group on our faculty. We have actually also a sex lab, which there's not many around the world. I will say we have probably 10, 15 around the world, mostly North America and Northern Europe, but not much actually in Southern Europe. I'm not sure if there's anyone else at the EUGLOH Alliance. I think not. But if you want to see a little bit of what we do there, please, you can take a picture of the QR codes and you could go inside the lab. We also have doctoral programs in psychology and one unique doctoral program in human sexuality, which is, again, the only one that we are aware, dedicated to sex research in Europe. And so, to sum up, I would say that we have the willingness, we have the resources, we have research capacity, and we are very open to, together with others from the EUGLOH, to develop this agenda of making sure we include mental health, psychological health, and sexual health at the core of EUGLOH and global health. So thank you for your attention.
So thank you very much for that really nice presentation. I think me and all of us learn a lot of stuff. The first question that came to my mind when you present the sex lab and the problem of having only data from North America, Central Europe and Northern Europe, is that, did you think maybe yes, that in EUGLOH there are 9 universities but more than 40 nationalities inside these universities, and maybe there is the plan to do a survey with those different questions according to the uni, according to the students where they grow and where they're studying now. Are there any scientific plan like that?
I think that is an amazing question. Not exactly the one that you said you were going to ask him, but even better. And the reason why I think it's even better, because I think that is why I think EUGLOH is an opportunity, is that bringing together different universities, but also not only the diversity of the universities in itself, covering Western, Eastern European countries, Southern and Northern European countries, but also, as you said, the ability to involve people and students and also actually researchers and professors who come from around the world. I think that will be probably the most important aspect of this opportunity. So, as I said, I think I was pretty clear. Of course, we at the University of Porto and our faculty have resources. We have a lab, we have a doctoral program. We work together with not only within university with other disciplines. We have the faculty of medicine also involved, the biomedicals also involved, but we have a global network also. And actually, just to say that, unfortunately, there's not many in our network, global network. There's not many of the EUGLOH universities. But I can share with you that we had already projects with Hamburg University, and I'm very happy that Hamburg is now included in the EUGLOH. And I am very willing to connect with others from the other 8 universities of the EUGLOH to advance this agenda. I'm sure there will be colleagues who are working on these topics and students. So I'll use this space to welcome everyone. And if you are willing, just contact me. I'll be happy to engage in conversations.
Thank you very much. Is there any other question from the audience about this subject or one of the 3 subjects we talked about today? Yeah.
Yes, thank you. Obviously, as a medical doctor, I am interested in many of these areas. But I am also particularly interested on dementia. You mentioned essentially anxiety and depression.
Yes.
But, with the aging problems in the countries that
yes.
make part of EUGLOH.
Yes.
Dementia will be a tremendous problem
Yes.
in the future. How to manage them in addition to nursing homes, because it's not in psychiatric hospitals,
Yes,
not
yes.
in ambulatory situations. How, as a psychologist, would you recommend to solve the problem?
Well,
First, and
Yes.
second, how to teach the students?
good. Well, I'm not a specialist in dementia, so let me start by saying that I don't have a miracle answer to that. But I would say that there is a very important. I mean, we are all aging. Actually, this morning there was a presentation discussing also the importance, or not important, what will happen, what is already happening, and will still. So the number of people with 65 or older will probably outnumber, in Portugal already outnumber the number of people under 20, I guess. So in Portugal, in other countries, it will be even worse. So all the problems will, and it's not only dementia is one, of course, and that definitely will make a huge impact, but also those depression and anxiety disorders will tend to at some point increase also with aging in some people. So the number and the quality of life that is needed, it puts a lot of, it puts a lot of pressure in the system. And I don't think the system will solve putting many in hospitals, whether they're psychiatric or others. So I think educating people for preventing, to not only know about mental disorders, about dementia, about its effects, and also, of course, caregivers are very important, I would say. But again, I'm not a specialist. But we need to put this into the public agenda, public awareness. I'm not sure. I don't think we are doing that, and I don't think we are supporting also the caregivers, who are very important, I would say. Without them, there's no hospitals that will ever solve the issue of not only dementia, or the psychiatric more stronger, let's say, psychosis or other kinds of more not chronic but problematic psychiatric disorders. So
Thank you very much. Is there,
Thank you for a very interesting presentation. But I was thinking, well, first of all, I believe that we should add psychology and mental health to EUGLOH's course.
Thank you.
It was very persuasive in that aspect. But I was thinking of articulating your presentation with the previous presentation, because we are told of existential health.
Yeah.
So could we think of anxiety, because you told us about different types of mental disorder, but anxiety predominates. So could we think of anxiety as a sort of existential problem rather than a mental problem?
Good question. I'm not sure how to answer, because the question of labeling is important. There's stigma, of course, and there's still stigma and discrimination around the word mental health or mental disorder. And so from that perspective, framing it into a different framework could be helpful. I would say that it's important. I mean, when I started studying, one of the studying mental health and not only depression and anxiety, because they are very interconnected. But one of the things that amazed me is the fact that we say that around 15% have a mental disorder, but it is currently. If we add studies about lifetime mental disorders, there are studies saying that a fourth to half of people at some point in their lives had a diagnosable mental disorder, depression and anxiety being the most common. So it's part of life in that sense. So framing that as existential life experience, I'm not sure if this makes sense, it could be a way to decrease stigma and discrimination, because it's part of life. Almost everyone in their lifetime will definitely have a problem related to, or psychological problem. either being depression, anxiety. It could be not at the level of significant clinical impact, but most probably at some point, definitely at that level. So if I look around, I won't ask this. Probably you all will raise your hand saying that, yes, at some point in my life, I was depressed. I was strongly, severely anxious, and so far and so forth. So that is part of life. So not sure if Lovisa will agree with me, but it will be probably another way of framing the mental health component.
So thank you for that amazing presentation. I would like to conclude because